Hi, I'm Dr. Aaron Bates, your Ventura County Spine Authority, and today we're going to cover some simple tips and, more importantly, safe tips that you can do at home to address your neck and arm pain. So the very specific type of nerve compression we talked about in last week's video is thoracic outlet syndrome. It means the nerve compression is coming from the upper chest right under the clavicle. So the first tool we're going to need, and I'm pretty sure you all have it at home, is a wall. Now we use the wall to stabilize our arm when doing this first stretch, and we call it the hand-wall nerve stretch. Now I know we're not supposed to ever do stretches when it comes to nerve conditions, but this is not a real stretch. This is more of an activation, and it looks something like this. The way that we use the wall is we're going to put our hand flat against the wall. Not ideal if you already have wrist problems. You're going to anchor your thumb right into the wall here. The reason why you're anchoring it is because you're going to actually twist your elbow. This is called external rotation, and you're going to feel a traction already somewhere in your elbow, maybe even under your arm, maybe even in your chest, while looking straight ahead. So you're perpendicular to the wall, but you're looking parallel to the wall. You're going to actually turn your head away, tractioning the brachial plexus through the shoulder all the way through to the elbow, even to the wrist. Depending on the type of nerve pressure that you have, you may feel this somewhere differently, but this is a nerve traction activation stretch. So not a real stretch, but more of an activation. The next tool is the foam roller. One of the 3 tools that I say every DIY guy must have in their home at all times, no matter who you are. Just great for general spinal maintenance. We're going to use this tool to actually address the kyphosis associated with, in the mid-back associated with the thoracic outlet syndrome or nerve pressure. It's actually an indirect route in helping your posture, but is critical for helping somebody suffering from nerve pressure. Okay, so we're going to lay down the foam roller lengthwise along our spine. Very simple exercise. All we're going to do is lay down here. Beautiful thing to do at the end of the night. Make sure you do it for a good 5 minutes. We're going to sit right on the bottom. Make sure our head is supported by the foam roller. Stretch our arms out wide. And then we're just going to lay here and breathe deeply. Very simple, very effective. Remember, less is more. And do this for about 5 minutes. You can do it up to 10 minutes. You could even do it for 20 minutes, but just because it feels good doesn't mean you should keep doing it. Try to minimize just to a minute or 2 the first time you do it and work your way up. This is the 3rd tool we're going to use. DIY guys might want to go buy a lacrosse ball, which is an incredibly inexpensive, very effective tool that you can use. This is something a little more fancier that we use in the healthcare world. But this we're actually going to use to mobilize the shoulder off the rib cage. Since we're going to do the exercise on the floor, again, this is not a stretch. Think of this more as a flossing of your teeth or a mashing of tissue combined into one. We use the hard lacrosse ball, and we're going to place it right where the superior angle of the scapula comes in line with the spine here. And this is actually going to put pressure on your first and second rib right on the back, which will actually take some leverage and stress off of the front of the rib cage. So we're going to take this ball and we're going to put it right on that position. And then we're going to do a little backstroke move here. Bring your thumb down. You're going to reach across your body to your opposite hip, and you're going to do a backstroke. And oh, Lord mercy, it is quite intense. That is okay. Any tingling and numbness going into the hand, that means stop immediately. And we're going to reach and do this multiple times, several passes. And the amount of time you want to do this for is about 2 minutes. Major contraindications for these techniques are if the nerve pain is increasing in the arm. It is okay if you are sore from the foam roller or the lacrosse ball, but if that pain is actually peripheralizing, which means it's getting further away from the body, that means it's getting worse. Your shoulder might be sore, but the nerve pain might be getting closer to your body. That means it's getting better. As always, these maneuvers and techniques are always done at your own risk. I always recommend you see a healthcare professional first for the proper diagnosis and treatment of these types of conditions. But that being said, it wouldn't be a DIY guide channel if you weren't doing it yourself.